Welcome to your high-yield explainer on heart failure. Over the next few minutes, we're going to cover the absolute must-know points for your exams and for the wards. Let's jump right in.
All right, picture this. You get called to see a patient and they are in serious trouble. They can't catch their breath, they look pale, their skin is cold and clammy. This is a classic medical emergency, and knowing about heart failure is going to be crucial for figuring out what to do next.
So, let's start with the basics. What exactly is heart failure? Let's get a solid definition down.
You know, at its very core, heart failure is really just pump failure. The heart, which is our body's powerhouse pump, simply can't push enough blood out to meet the body's needs, or, if it manages to, it's working so hard that the pressures inside the heart get dangerously high. Now, heart failure isn't just one single thing. It's a huge clinical syndrome, and to really understand it, we've got to break it down and classify it based on a few key characteristics. We can slice and dice this in three main ways, and this really helps us figure out what's going on. First, by sight. Is the problem on the left side of the heart, the right side, or both? Second, we look at chronicity. Did this happen suddenly? That's acute. Or is it a long-term problem, which is chronic? And finally, we classify by function. Is the heart failing to squeeze properly? That's systolic dysfunction. Or is it failing to relax and fill with blood? That's diastolic dysfunction.
For the rest of this explainer, we're going to zoom in on the most dramatic and urgent version, acute left heart failure, or ALHF. This is exactly what was happening to that patient in our first scenario.
So what does this actually look like at the bedside? Well, on the left you have the symptoms, what the patient is telling you. They'll describe a terrifying sudden shortness of breath, they can't lie flat, we call that orthopnea, and they're just completely wiped out. Then on the right you have the signs, what you find. Their hands and feet will feel cold, you might see a raised jugular venous pressure in their neck from the fluid backing up, and you might hear a third heart sound, a gallop rhythm. But the absolute classic sign, it's what you hear when you listen to the lungs, those crackles or bilateral basal crepitations.
Okay, so you've got a strong clinical suspicion, but how do you confirm it? What are the key tests you need to order right now?
There are three really important investigations that will help you nail the diagnosis. First, the chest X-ray is critical. You're looking for that classic bat's wing appearance of fluid in the lungs, alveolar edema, and these little lines called curly B lines. Next, an echocardiogram gives you a direct look at how the heart is pumping and if the valves are okay. And finally, you'll need some basic blood tests, paying really close attention to their kidney function.
All right, the diagnosis is clear. This is an emergency, and time is everything. So what are the immediate life-saving steps you need to take?
Okay, your immediate management follows a pretty clear sequence. Step 1, sit the patient up. This helps reduce the amount of blood returning to the struggling heart. 2, get them on high-flow oxygen. 3, if they're still struggling, CPAP can help support their breathing. 4, nitrates help open up the blood vessels and take the strain off the heart. And 5, you give a powerful diuretic through an IV, like furosemide, to get that excess fluid off as quickly as possible.
Okay, let's wrap this up with a super quick summary of the absolute must-know points.
So if you remember nothing else, remember this. Heart failure is pump failure. The classic acute presentation is sudden, severe breathlessness. The key sign you need to listen for is those basal crepitations in the lungs. Your number one investigation is a chest X-ray looking for that fluid, that edema. And your immediate actions are always sit the patient up, give them oxygen, and get them some diuretics.
And that leads us to our final thought. You've followed the protocol, you've stabilized the patient, and their breathing is starting to get better. You've handled the emergency. But the big question is, why did this happen in the first place? Your job isn't done. The next and absolutely crucial step is to start digging for the underlying cause. Was it a heart attack? A valve problem? Something else entirely? Finding that out is the key to managing them in the long run.